Mike McCool here in the Royal Examiner studio. With me today is Kayla Roberts. She is from the Winchester Medical Center, I guess we'll call it that,
Yeah.
Valley Health, correct?
Yes.
And today is February 7th, and we're going to try to post this today.
Okay.
This is Wear Red for Women's Heart Information Day, whatever
Yes.
they want to call
Yeah.
it. It's got a long name.
It does have a long name.
And I said, we were going to do this yesterday because of the weather and everything. We postponed it. I pulled out my red shirt to wear, and then I remembered I was looking for it, and I have one. So anyway, sorry, I'm not wearing red.
It's okay.
But I see you have it on, and
Yes.
that's great. So let's talk about Go Red for Women. Let's talk
Yes.
about what that is.
I'd love to. So, Go Red for Women is originally created by the American Heart Association. Everybody knows.
And this
hopefully
is Heart
knows.
Month, by the way.
This is Heart Month. Not only is it Go Red for Women Day, but the entire month of February is Heart Month, so recognition for heart disease. But Go Red is the first Friday in February every year, and it's really focused around women's heart disease and awareness. Because most women tend to be the caregivers in their family and
Yes, they are.
typically don't focus a lot of care on themselves.
Right, right.
So it's really meant to band together, show your support, of course, wear your red,
Sure.
and really get information out there on women and heart disease and how it really can impact women too.
So what's your role at the hospital?
I am the clinical manager for our cardiothoracic surgical program. However, I also oversee our heart failure, our chest pain center, which I'd love to talk to you a little
Right,
bit about,
sure.
and our outpatient cardiopulmonary rehab. So my role really, I have several areas in the heart and vascular service line.
Well, I was telling you before we started, I'm part of that Zipper Club, you
Yeah,
know, and
yes.
I've used that service in Winchester.
Yeah.
By the way, they did a great job. And that's been, my gosh, 24 years ago.
Oh, wow, good.
So I guess I'm still ticking,
Yes.
right? But again, I didn't have any symptoms. My symptoms were like my jaw hurt and it's not your typical, I had no pain, no nothing, all that. And women have some unique
They do.
symptoms that men don't have, right?
Yes. So women can be, unfortunately, we're different.
Yes.
So I like to, when I do education, I like to say it's not your typical movie heart attack. I
Right.
think most of us, or if you have personal experience, you watch it on TV and somebody just clutches their chest
yeah.
and everybody in the room knows what's going on.
Right,
Well,
right.
it is not like that.
No, mine wasn't like that at all.
I know yours wasn't either. Common symptoms are chest pain, shortness of breath, pain that can go up in the neck or radiate down in an arm. Women can experience all those, but they also present a little bit differently. Women can have pain that radiate into the back, up into a jaw only, into an ear, and it sounds like you had the jaw
Yeah,
issue,
right.
or constant burning and pain. They tend to less present with a crushing chest pain or an elephant chest. You can also get what we call a feeling of impending doom.
Right, I've had
where-
that before.
Yes, and
it
it's
does
scary.
Feel weird, doesn't
It does
Yeah.
feel weird.
Yeah.
But those are signs that we really don't want people to ignore. And then when
Right.
you're experiencing them, to call 911 immediately.
Right.
The other key piece to that, and we did a really great campaign a couple years ago called Survive, Don't Drive, where we really promoted the signs and symptoms of a heart attack, talking about how women can be a little bit different and not
Sure.
to ignore that, and then really calling 911. They can get you to the closest treatment facility and alert this facility ahead of time,
Right.
so the team can be there waiting for you if you're actually actively having a heart attack.
Right. Yeah, the worst thing you can do is drive yourself.
Yeah, but people often still do that,
I did it.
unfortunately. Yes, yes.
But one time I can remember, though, I had this pain. I've never had it before. All of a sudden I had this pain. You know, this is after my surgery and stents and everything else they do to you. But I went ahead and went to the hospital anyway.
Good.
And I think that's the thing. Even if it wasn't heart, it was heartburn or something.
Yeah.
But they have the same symptoms, you know.
Yeah.
And but the doctor said, "Oh yeah, please come because
Yes.
you just never know."
Correct.
And I do one thing: when you walk in and you say, "I have chest pains," there's none of this waiting around for you. They just take care of you right then.
Yeah, at every one of our facilities, we have an immediate protocol for that. They take you, they do some testing right up front.
Right.
So we know we can determine that in about 10 to 15, 20 minutes.
Yeah. Yeah, and sometimes that's the period of time that makes a world of difference, especially
Yes.
if you're having a stroke or some kind of actual heart attack. Like I didn't have a heart attack per se,
Yes.
but I could have. You know?
Yeah, and the saying we like to use, I like to say time is muscle because heart is a muscle, but
Sure.
time is tissue is a good one because
Sure.
it applies to both the brain and the heart. So if you ignore your symptoms long enough and you can also get all the way through the end of a heart attack, unfortunately, your muscle dies and we're not able to do anything with that at that point in time. So that can lead to reduced heart function and other things.
Yeah.
So we want you to get there as soon as possible.
Yeah, time is, like you say, time is your friend there.
Yes.
You want to speed it along.
Absolutely.
I just think when you mentioned something about obviously the symptoms are a little different, but women's brain works a little different when it comes to things like this because you're right, they're typically the ones that are the caregiver for the husband or the children, and they're like they always reduce their symptoms and just kind of ignore them because and I think we need to be better caregivers of our spouses, don't we?
Yeah, yes, and it's a family thing, like supporting each other, simple things of knowing the signs and symptoms, having a magnet, something printed out from the AHA, knowing when to call, and then supporting each other, and not only advocating for their symptoms, but healthy eating habits and things like that, because everybody should have yearly checkups. But again, that sometimes can get lost when you're a mother, when you're working, just trying to taking care of a parent.
Sure.
So a spouse.
A lot of distractions.
It's easy to be distracted.
Well, and we need to learn to read the body language because you can tell. I'm sure you can tell when someone I do something and I make or I move my hand and I make a. You all right? You all right? Yeah, I'm fine.
Yeah.
And, that's what we do. So I think we need to know what the symptoms are and how our spouse and children and again, children have these things as well. So it's not. We're seeing more and more of that. Cause of all sorts of reasons, but let's talk about some of the things women can do and men, but primarily since it's Go Red for Women Day, we want to talk about that. We talked about our diets and everything else. I know that's really important. You have some tips for people?
Yeah, so an annual primary care visit, that's really important. Healthy eating, obviously, is another one.
Right, we got to cut out this fast food. It's not, look at this, it's killing us.
Everything in moderation, right? So that's what I try to teach and live as an example, which can be really hard sometimes. But healthy things in moderation, picking the American Heart Association, the Valley Health website, and others out there have really great information and tools of how to progressively do things slowly.
Yeah.
If you like to have pizza on Friday, it's okay to have pizza on Fridays.
Just don't eat the whole thing.
Right. Don't eat the whole thing. And then, try not to be doing it every day of the week.
Sure.
Getting your daily water intake. Exercise is really important. Exercise can look so different for everybody.
Sure.
It doesn't have to be going to the gym. It can be getting your steps in.
Right.
There's a lot of technology out there right now, Fitbits, iWatches. Everybody has smartphones. Even counting your steps, being mindful in that, trying to get greater than 10,000 steps a day if you can. Even if that's vacuuming around your house while you're doing something else.
Walmart's a great place because you just go down, up and down get that cart and walk around, and especially as you get a little older, when you have a little shaky, you can grab hold of that cart and just walk up and down every aisle. It's amazing how many steps that is.
Yes, it is. And when you're in Walmart, that's a great pretense. Or when you're out grocery shopping, the American Heart Association and other organizations, when you're buying food, if you look on the back on labels, they have a heart check of heart healthy food. When you're grocery shopping, try to stay out of the middle aisles and hang more towards vegetables in the aisle. Anything fresh is better. And if you're interested in supporting your local farmers markets, that's always great. And different tips.
I see people now reading labels that we didn't used to do.
We didn't used to do. Label reading and understanding, that's really important. And then knowing if you're going to the doctor or getting somewhere, even if you don't have a doctor, don't have time to make it, there's wellness festivals and things like that. We have one coming up in the month of February, the Apple Blossom Mall at the end of the month, where we have blood pressure screenings.
I was going to say, even as simple as just getting your blood pressure checked. I know that
once a year, and if the numbers are high, then we can give you tips on working it, reducing your sodium, exercise, maybe advising you to start medications. But small steps like that really can make a big difference.
Simple as just getting that blood pressure checked. Yeah. we all have that white coat syndrome, you know.
Yes, and it is a real thing.
Yeah.
And it makes people anxious. People who maybe as children weren't used to getting health care a lot, it can really be anxiety provoking.
Sure.
But even usually at your local pharmacies.
Yeah.
They
And
have
also fire departments.
fire departments, that's a
You can
great
just go
point.
in and say, please check my blood pressure.
Yes.
And they'd be glad to do it.
Yes. So
When you said that, first thing that popped in my mind was that broken heart syndrome, you know, and that's stress. And those are relationships cause a lot of stress on us, and we don't realize that affects our well-being and our heart.
it does. And one thing about stress does affect our well-being. There are studies out there, and so we're just doing a media campaign within our organization. We like to involve our staff and get them going, but it's called Best Friend Fridays. And so today is Friday. I do not have my picture of my little best friends with me, but I have 3 dogs. And you don't have to be a dog person. It could be a cat.
Fur babies.
Fur babies, any kind of fur, could be a bird, but they have been shown to improve your emotional health and your longevity. So honestly, a companion is also something that's really wonderful and helps your emotional stability and also helps your health. So
First time I heard that, I was writing an obituary and they had their fur babies. I had to go look it up because I thought, what is a fur baby? But, you know, you're seeing more of that, you know, there's a lot of fluff about it, but, you know, just caregivers or a companion. And it's health-related animals and things that people are using more and more of, and you're seeing that it does work.
it does, and
It does
there's literature to support that.
Yeah.
Just having those companions, you know, even going home, having them there, petting them, just sitting down, relaxing, it has been shown to improve.
Yeah,
So it's a wonderful thing.
All right, now there's something else you wanted to talk about if we had time, and of course we do.
Oh.
So what is it? You done forgot already. No, you were going to mention it, and now I'm going to try to remind you and put you on the spot. A program.
Yes. As we were chatting before we started, I wanted to really support your local EMS. We have first of all, they're wonderful. They're amazing. Anytime you call 911 with chest pain, shortness of breath, or heart attack symptoms, they're going to come right to your home. When they get in there within the first 5 to 10 minutes, they're going to do a test called a 12-lead EKG, look at it, interpret it, get some blood pressure and other vitals. And if they see you are having a heart attack, they're going to take you directly to a PCI-capable facility. For us, that would be Winchester. And they have an application that we share with them, and we can also share with them via phone in case they didn't have cell phone service. But they can actually take a picture of the EKG and alert the cardiac cath lab team from home and the cardiologist, so that if you're coming all the way from Front Royal, Luray, you know, somewhere in West Virginia, anywhere, that team can actually be waiting there for you, and we can reduce the time and bypass everything and get you right into that cath lab, and we can open up your coronary arteries.
You mentioned that cath lab. You want to touch base on, that's really a remarkable thing.
Yeah.
And it's come a long way. Like I had one 25 years ago, and I didn't even know they existed, and there's more and more, and they're expanding, and all the things they can do, not invasive.
Yes, they can do so many things now, and it's really come a long way. When that was first introduced, and I'm going to get my dates wrong, I'm going to say a long time. We'll just say a long time ago.
Yeah.
They used to go over there and only be able to balloon open, and oftentimes that led to emergent open heart surgery when they were first testing those theories in the beginning. Now we can get you in there, stent you, get everything open.
Put in new valves.
Yes, we can percutaneously put in new valves now. That's in our hybrid locations.
Right.
A structural heart.
And they got this robotic surgery that now they can do a bypass without even cutting your chest open.
So we have robotics that they can
Amazing.
use for thoracotomies and things.
Yeah.
We can do so many things. Roto-rooters, mechanical support devices if you're sick, because oftentimes people can come to us very sick, that allow us the time to get in to do what we need to support you. So it really has come quite a long way. Our teams are very sophisticated, and they work really well together, all the way out from EMS to into the hospital to post-op in our ICUs.
I don't think people realize how our EMS, how well equipped they really are.
They are.
And it's great because we've used them in our family, and they're Johnny on the spot, you know, and they're highly trained. And
They are.
You know, years ago, and it was like, okay, I can drive the truck, so I'm on the EMS team. But over the last 30 years, there hundreds and hundreds of hours are required to become an EMS, and then more continuing education. So it's a lot. I mean, it's a skill set that they have.
It is a skill set. It's very important. It's important to the community. And they work with us not only for heart, trauma, everything, and we do a lot of education drills and training
sure.
together.
Sure. Well, let's finish up on Go Red for Women.
Yeah.
Let's talk about reiterate some tips for women and let them know that let's pay attention to some of these symptoms.
Yeah, so just finishing off with the signs and symptoms, standard are chest pain, shortness of breath, pain in both arms, typically more down the left, or pain radiating up into your neck or feeling like burning. Atypical symptoms, which can present in anybody, but could tendency in women, back pain, really up into the jaw, into the ear, and a feeling of impending doom or nervousness.
I think that's something right there that we always put off.
We put off, yeah.
And I think that's something that we, sometimes you just know that there's something wrong and you don't know what it is, and you figure like, well, it's just me.
Yeah.
And I think that's the symptom that it's okay to go to the emergency room.
Yeah, and that's what we're here for. It's okay. We want you to get taken care of and everything, so it's great. We're never going to tell you no, and that's what your EMS is there for, too.
Yeah.
So don't ignore your symptoms. If you have a chance today, get on the American Heart Association website, download an infographic, or if you go to one of our local facilities, please stop by. We have handouts and literature that we can give you. Keep it on your refrigerator. See a primary care physician once a year, or go to a local wellness festival. I do encourage you to have a primary care physician, but sometimes that can be, anxiety provoking for some people.
We don't want to wait.
We don't want to
wait till you're 60 or 70 years old and decide. Let's do it when you're 20 and 30 and 40.
Yeah, and just get ahead of it.
Yeah. Kayla, I really appreciate you coming in and sharing this.
Thank you.
And Go Red for Women.
Yes, thank you very much.
All right, thanks again. Appreciate
Have a good day.